In this segment, we'll learn key criteria for giving timely, sensitive, and instructive feedback to improve others' performance, as well as how to receive feedback to improve our own performance within the team. So what is feedback? Feedback is communication that gives specific information to a person about their actions as a way to help them better achieve their goals. Note that the emphasis is on helping the receiver, so the feedback is always given from a position of caring and support. We generally describe feedback as either summative, such as a final grade, final evaluation report, or yearly review linked to bonuses. It measures level of achievement or proficiency. Feedback can also be formative, providing information and suggestions for improving performance over time. This module will focus on formative feedback as a method to improve the function of healthcare teams. Formative feedback can be peer-to-peer, leader-to-member, or member-to-leader, depending on the circumstances and team needs. One important role of a leader on a healthcare team is to facilitate the team working to its highest potential in pursuit of patient care. In an earlier segment, we learned key functions of an effective leader, and many of these functions require the ability to give effective feedback to help team members reach their full potential. For example, helping the team maintain focus on goals, raising awareness of the knowledge and skills of team members and what they need to do their job, helping create a culture where seeking help and expressing concern is encouraged. These cannot be done without good feedback skills. And feedback can help both team members and leaders function better. Additionally, both team members and leaders must be able to hear and respond appropriately to feedback when given in return. So one strategy for giving feedback is to remember keep, start, stop. This reminds us of the 3 components that should be included in the feedback. We want to start by discussing things the receiver is doing well and should keep doing. Next, we discuss things that receiver could start to do that could improve performance. And lastly, we address behaviors that should be stopped. Although in general starting with positive feedback is best, the start and stop portions may be interchanged as best fits the situation. And once you know what should be included in feedback, it's important to focus on how we give feedback to maximize the chance that the receiver will be able to accept and use it. We will review 5 brief things to keep in mind while using keep, start, stop. First, it's important to be selective about what you choose to share. Do not share everything you've noticed because most people can only absorb 1 to 2 areas to work on at a time. Choose the critical points you feel are the next steps needed to give the receiver a place to grow from to reach the next level. As an example, you might say one thing you can improve on is active listening when other team members are speaking. Rather than, I've noticed that you often seem distracted in team meetings. Your notes also seem unfocused and tasks are not completed on time. In addition, you were late 3 times last week. In addition, take into account the needs of the person you are giving feedback to, as well as your needs to communicate specific areas for improvement. Set a time and location that's comfortable for both the giver and receiver of the feedback. It's challenging for one party to be engaged if they're occupied with other tasks that must be done, so select a time and quiet place amenable to good communication. Offer but don't force feedback on anyone. As an example, you might say, I'd love an opportunity to discuss your thoughts about your performance in the team so far. When would be a good time for us to talk in the next few days? Rather than, I wanted to make some suggestions I noted while you were rounding today, and I'm sure Dr. Smith wouldn't mind if you're late to clinic. Try to focus on specific behaviors rather than character traits of the person. This can be done by using adverbs which refer to specific actions, rather than adjectives which place the focus on the person. The goal of the feedback is to change behavior. An example is, you talked considerably during the meeting and didn't always give others a chance to answer. Rather than, you're too loud and really bossy. Another key to giving useful feedback is to be as specific as you can regarding the behavior that needs modification. the most helpful feedback is direct and concrete. You might say something like, "I thought that the way you sat down and leaned in while listening to the patient was especially effective in showing engagement," rather than, "I liked your body language." And as a last tip in how to give feedback is to focus on developing and sharing ideas jointly rather than directly giving advice. Help the receiver explore several alternatives that might best help them develop their own plan and reach their goals. An example is, "It seems you are not prepared to discuss patient plans during rounds. How can we improve this so that the team works more efficiently?" Rather than, "You need to come in earlier and read up on your patients before rounds." After exploring different ideas, always check to make sure that communication has been clear. This can be done by having the receiver rephrase the feedback to make sure that what the giver intended is what the receiver understood. And while the ability to give appropriate feedback as a team leader is invaluable to team growth, so is the ability to seek out and use feedback as a team member. We will wrap up this segment with strategies to receive feedback in a way that optimizes our own growth. So first, it's important to know your tendencies. Do you tend to be defensive when receiving feedback? Tear up? Strike back? Agree but not change? Know your tendencies so you can better keep an open mind. Second, disentangle the what from the who. Sometimes there may be relationship challenges with someone you need feedback from. Don't let these challenges cloud your ability to receive feedback. Learn to separate the messenger from the message. Third, sort toward coaching. Coaching or formative feedback allows you to learn and improve. Avoid taking feedback as a judgment or criticism, and sort toward hearing feedback as valuable advice. Fourth, unpack the feedback. Before you accept or reject it, work to better understand it. Ask for clarification if feedback is vague, or explore where the feedback's coming from. Clarify what the expectations are going forward and why. And finally, ask for just one thing. It's important to seek out feedback, but avoid unfocused questions such as, "Do you have any feedback for me?" Instead, have a specific goal such as, "What is one thing I could do better for patient communication?" This will allow the giver to focus on the areas you want to work on most at this time. So in conclusion, learning to give and receive feedback effectively is important in helping the team achieve its highest potential. The components of effective feedback can be summarized as keep, start, stop. And in addition to being able to give effective feedback, good team leaders and members know how to seek out and use feedback to improve themselves as well as their healthcare team. So take an opportunity to practice these steps just outlined during your next feedback session. For this segment's forum discussion question, think of constructive feedback you have received that was especially effective in helping you change your behavior and attain your goals. What did the giver do or say that made the feedback especially effective for you?